My name's Leanne Browning. I'm an education student at Murdoch University. Today we're talking about the learning difficulty dyslexia in secondary students. I've used the fonts Curls and Times New Roman on this slide to show that they're considered particularly hard for people to read, although their readability can be improved by increasing the spacing between the letters. Dyslexia refers to problems in reading and is diagnosed by an educational psychologist. The wait list for your school site may be long and private assessments are expensive, so not all students who have dyslexia will be diagnosed. Dyslexia now comes under an umbrella of specific learning disorder, so the terms specific learning disorder in reading and dyslexia can be used interchangeably. Diagnosis applies where a student has ongoing and unexpected problems reading. That is, they have the overall intelligence and physical abilities to read and have had the opportunities to learn to read. In Australia, you may expect 1 in 10 students to have dyslexia, so you can expect to teach many students who experience this difficulty. Dyslexia is a neurological problem. This does not mean that the student has brain damage or even that they have a low overall IQ. It does mean that these students manage and process information related to language differently in their brain. You could imagine that their brain is wired differently, and hence these students learn differently. Reading problems are an early difficulty picked up for these students at school. Regardless of how well they go on to read, they're likely to have ongoing problems with spelling and writing. If you consider that writing doesn't just come from operating your hand, there are many mental processes that direct that motor function. Students with dyslexia have been shown to have problems rapidly naming letters. Hence, writing problems may be partly caused by problems in retrieving that information about letters and words from memory. Students are likely to be slow to complete their work, have problems following complex verbal instructions, and difficulty finding words when they're talking. By secondary school, students may have developed strategies to avoid reading and writing. There is a risk that adolescents may take on a negative identity and develop these unhelpful coping strategies like avoidance. It was previously believed that males experience dyslexia more than females. Research has questioned this and suggests that this is a myth. One of the most popularly held beliefs anecdotally is that coloured glasses and overlays help students with dyslexia to read, and this may be a question that parents of your students ask you about. There is strong research evidence that this is not the case. Glasses do not improve reading skills, although there may be a small proportion of students with dyslexia where the glasses reduce some visual distress while reading. There's also poor evidence for the effectiveness of the commercially available Dyslexia font. A common belief is that reversals in letter formation are a key criterion in identifying dyslexia. Letter reversals are actually common in early schooling, but they should resolve. Although letter reversals are not a hallmark of dyslexia, when older students continue to make reversals, they should be encouraged to work on this by giving extra mental attention and time to those letters they commonly reverse. This student is about to enter Year 7. She has been diagnosed with dyslexia, and that is a sample of her writing and spelling at the end of Year 6. To be inclusive, a teacher should know her strengths and interests. She's more likely to engage in reading and writing work if it's about these subjects. Of course, those interests may change across her secondary school years. This student's parents said that it's a problem when the expensive psychological reports are too complex for parents or teachers to interpret, and as a result, few strategies are employed. The recommendation is to work with your school psych or inclusion officer to help you identify key recommendations. Any strategy you consistently employ could have huge benefits for that child and also potentially help other students. University and TAFE level students with dyslexia show that they accept their dyslexia as a different learning style rather than an impairment. They use time management strategies and learning supports to maintain a positive student identity. There is strong research support for targeted literacy programs such as Multilit, and teachers should advocate for their students to have access to them. Inclusive practices recommended for students with dyslexia include providing additional time, understanding that routine literacy tasks require effort, repeat information and check if it's been understood. break instructions down into discrete chunks. One specific strategy I would recommend for secondary students with dyslexia is to allow digital submissions and the use of electronic portfolios. Digital work allows adolescents to use the technological language with which they've grown up. They can use multimedia techniques to display their learning and access information in ways other than traditional texts. The second specific strategy I would recommend is the use of task cards and hard copy printouts. The danger for students with dyslexia is that every task becomes a reading and writing challenge, and they miss an opportunity to engage with the task at hand. Task cards can allow the student to skip the step of copying from the board and allow them to check their understanding of the instructions. Suitable hard copy printouts of information allow students to engage directly with that content material, whereas other methods of research, such as Googling, may be an overwhelming task. I've provided some references here, and for those students from inclusive education, please feel free to ask questions in the forum.